PRS for the opportunity to do this presentation. Yes, and thank you all for attending. Yes, so today we are going to be looking at what plastic surgery really is about. And sorry, a minute. Laura, please, am I able to share my screen?
Yes, I think so. Yeah, you can.
All right, thank you. A minute,
Okay.
please.
All right.
Yeah, please, can you see my screen?
Yes, please, we can see it.
Okay. Like I said, we are going to be talking about what plastic surgery is really about and what plastic surgeons do. Um, yes. So for the presentation today, we'll look at what plastic surgery is. We'll talk about the history of plastic surgery. We'll look at plastic surgery in the developed world, main areas of plastic surgery. We'll look at plastic surgery in Ghana, West Africa. I couldn't find much information on plastic surgery in Africa in general. Then we'll also look at preparing for a career in plastic surgery and then the training pathway. So this is what we'll mainly look at today. So, what comes to your mind when you hear about plastic surgery? For most people, when they hear about plastic surgery, they think about aesthetics. They are thinking about the Brazilian butt lifts. They are thinking about the tummy tucks, the fillets, and the Botox. Usually, when we say plastic surgery, people think we are talking about just the idea of making people look pretty, and the public is not much to blame for this because I think over a period we can all attest to the fact that most of the news we hear on TV and on the internet, which relates to plastic surgery, is usually celebrities going in for some sort of enhancements or yes, something like that. So it is not really a surprise that the public, when you mention plastic surgery, usually we are thinking about the aesthetics. So we talk about the Botox, the lip fillers. We also have the Brazilian butt lift and then some implants. I think when I heard about plastic surgery, I think the first I heard of plastic surgery was when people, they will say people have done boob jobs. Yeah, so that's breast augmentation surgery. That's, I think, the earliest I heard about plastic surgery. But then with time, I got to know that there was more to plastic surgery than that. So we also have the famous Chris Jenner, who recently has gone in for some new surgery that has made her look way younger than she is. So this is what the public thinks when you say plastic surgery. It is part of plastic surgery, but is that all there is to plastic surgery? So today we want to learn if that is all there is to plastic surgery. The answer is no, because the pictures we have here are also plastic surgery. The pictures here are showing burn victims before and after they had some form of reconstruction to enhance their scarring or the traumatic injury that they they had. This is a very interesting story. So the what made me interested in plastic surgery was I read actually about a young boy who liked baseball, but then did not have like his hand. He had a problem with his hand and it wasn't functional, and so he couldn't play baseball. Then finally, through a reconstructive surgery, they were able to do some major surgery on the hand, and after that, he was able to play baseball. But this is a very interesting story because this was the first time I heard that I found out that they actually do facial transplants. So this is a young man in the US who was a firefighter. He volunteered as a firefighter, and then during one of their operations, he sustained very severe burns, and this was the outcome. And so so this is the before picture, and before the surgery, he was at risk of losing his eyesight because he couldn't blink, and then he couldn't show any facial expressions. But then they they were able to perform surgery for him, and that was the first time I heard about facial transplants actually. And so they were able to perform facial transplants for this man, and then after that, the risk of losing his sight was eliminated because now he could blink and he could show facial expression. So this is to tell us that plastic surgery has functional. Plastic surgery is not just about the aesthetic part, but then we are also looking at functional reconstruction so that we can improve the quality of lives of patients. And this was in 2015. So this is also a picture of cleft lip, which is also something that is under plastic surgery. So a certain conditions, they are classified as either an abomination or some sort of things. But now with plastic surgery, we do not have to condemn children because this can easily be fixed. So yes, this is also plastic surgery. This is also plastic surgery. So this is a child that was born with an abnormal ear, but was able to undergo ear reconstruction. So yes, this is plastic surgery too. What then is plastic surgery? So plastic surgery is a surgical specialty that is focused on reconstruction, restoration, and aesthetic improvement. And it comes from the Greek word plasticos, which means to mold or shape. And that is where the name is coming from. So it involves both reconstructive and then the aesthetic or the cosmetic component. Early history of plastic surgery. Even before plastic surgery became known as plastic surgery, there are records of um, people already doing reconstruction. So as far back as 600 BC in ancient India. So the background story is that in India, nose cutting was a form of punishment, and so they will cut the nose of people as a form of punishment, and so there was a need to come up with a way to reconstruct that nose. So suturing is was a physician in India, and he is the first, as far back as we can tell, that's the first recorded evidence of reconstruction, where he described reconstructing noses after they were punished by cutting. So they used skin grafts from the forehead and then other places. Yes, and then also in ancient Egypt and then Rome, early wound repair descriptions that also points to reconstruction. Also proves that as we plastic surgery has been there for quite some time. So development in the Western world, the term plastic surgery was established or introduced in the 19th century, and in plastic surgery because of the World War One and World War Two. So modern reconstructive plastic surgery became a thing after World War One because a lot of the soldiers and then they sustained war injuries, traumatic injuries that required that they'll have to undergo some form of reconstructive surgery to be able to make them functional again. Yeah, and then Sir Harold Gillis is regarded as the father of modern plastic surgery. So after World War One, it was the reconstructive part of plastic surgery that had been established. But then by the end of World War Two, that is between the appearance, sometimes even of the reconstruction that had been done, and that is how cosmetic enhancements also became a thing. Talking about in the developed world. Yes, but then we have microsurgery, and microsurgery is actually a very interesting and a very interesting part of plastic surgery. And so they reconstruct blood vessels and the nerves, which is important for moving tissue and of how a patient had Bell palsy, hemifacial paralysis, and so they harvested the sural nerve, which is in the leg, in the face, and after that, the patients, so that kind of cured the patients or treated the patients and paralysis. So yeah, so that is some example of microsurgery. Also, injury that had affected his upper limb, and so they they used his latissimus dorsi at the back to reconstruct the elbow flexor, and because of neuroplasticity, they were able to train him to move the elbow by, in his mind, trying to activate his latissimus dorsi, and that is how he's able to use his elbow for function. We also have craniofacial surgeries, hand surgeries. So craniofacial is where they deal with issues of the face and then yes, the head. So soft tissue issues. So cleft palate comes, cleft um, lip and palate comes under that. And then also we have craniosynostosis. So sometimes we see that people have abnormal head shapes. Yes, because they have maybe some premature fusion somewhere. But now with plastic surgery, they are able to correct all of those things. So that is all part of some of the advancements we are seeing in plastic surgery today. So the main areas of plastic surgery, when we talk about plastic surgery, we have the reconstructive surgery and then the aesthetic or the cosmetic surgery. Some of the common reconstructive procedures we see, we have burn reconstruction, and I think that is the major one that we currently have in Africa. Well, at least Ghana. And burn reconstruction is the biggest plastic surgery area that even as students when we go on rotations. That's what we usually um, see on the wards. So also the bed conditions, so cleft lip and palate, all the ear malformations can be treated with plastic surgery. So that's reconstructive. Hand surgery, craniofacial, microsurgery. So when we talk about reconstruction, it's often medically necessary. It's not sometimes it's not often that it is optional because it is essential to maybe the patient's physical health or psychological well-being in some way. Also, skin cancer reconstruction, we have breast reconstruction reduction, nerve reconstruction, post-trauma reconstruction, skin cancer reconstruction. Okay, and then gender affirming surgeries. I don't think that is a very big thing in Ghana, Africa currently, but even they do offer gender affirming surgery as plastic. When you go for, I saw at the Ghana College of Physicians and Surgeons that they actually do teach that, even though it's not very common in our setting. And so some of the common aesthetic procedures, we have rhinoplasty, that's the common nose job that we hear about, breast augmentation, body contouring, scar revision, liposuction. Then we have the non-surgical ones, that's where we have the skin fillers and then the Botox and then the chemical peels, and then the others. So in 2018, even though we hear more about the aesthetic part of plastic surgery, actually, if we take away the non-surgical parts, which is actually highly patronized, and we want to just compare the reconstructive and then the aesthetic. For the in 2018, when they did a study, in the US, they realized that there was like 5.8 million cases of reconstructive, um, which were reconstructive surgery, as compared to 1.8 million that was the aesthetic part. So we can see that even though aesthetic is actually very popular, there's a very huge demand for reconstructive surgery in the world, or in medicine. So who is a plastic surgeon, plastic and reconstructive surgeon? He is first and foremost a fully trained medical doctor who are specialized in reconstructive and aesthetic surgery. And usually they work in multidisciplinary teams. We are looking at responsibilities of a plastic surgeon. So like every other doctor, they have to do patient consultations and evaluations. Then you have to do surgical plannings, and this is being made easy with the 3D imaging, which has come up. So it allows the patient and the doctors all to see what the possible outcome of the surgery could be even before they perform the surgery. And then performing surgeries, of course, then the wound scars and healing, and post-op care, all of that, and then emergency trauma care. So settings, where will you find a plastic surgeon? So they work in teaching hospitals, they work in burn units, they work in trauma centers, then also plastic um, private clinics. Yes, so I also found out that a lot of people like the idea of plastic surgery because they think there's money there. And well, even though there's money, most of the money is kind of in the private clinics where they do more of the aesthetic work. So if you're looking for money, then maybe the private plastic surgery clinics are where you should be looking at. Yes, so plastic surgeons combine science, precision, and creativity. So plastic surgery in West Africa. So plastic surgery was developed through collaboration with international teams, and the earliest record we have of a burns center in West Africa was in 1997 when Dr. Jack Mustard and then some people came together to construct a 75-bed unit at the Kolebu Teaching Hospital. So that's the first that's the records, what the records show us to the first reconstructive and plastic surgery. Yes, and that was when the first Ghanaian was sent to Glasgow for a 2-year training in plastic surgery. So before that, we did not have any plastic surgeons in West Africa, in Ghana to be precise. So challenges facing plastic surgery in Africa. We have limited number of trained specialists in Africa, and unfortunately, we have inadequate equipment and funding. There's low public awareness, which I think we can do a lot to work on. There's also disparity in access to plastic surgery services between urban and rural areas, and this is something this is a very big problem because when you leave for plastic surgeons, usually they are all to expand local training programs, more specialists who can provide services, especially in the rural areas. We need improved facilities with the state of the art equipment. We also need insurance and financial support for essential plastic surgery services. Recently, there's been questions about whether breast reconstruction after mastectomy should be funded. Because currently in Ghana, the mastectomy is supported, it's under the NHIS, but then the breast reconstruction is not. And but then if we are thinking about health, good health in general, we want to use the WHO's definition, then it's not just about the fact that you have cured the patient of cancer, is the patient's psychological well. So, unfortunately, in our part of the world, in Africa, there's not much research that we are still developing the area of research. And so, maybe with time, when we do more research, and then we are able to understand the impacts of these surgeries, such as mastectomy on the psychology of the patients. Then with time we can find a way to make sure that there's insurance and financial support so that patients can undergo the essential plastic surgery services that they need without having to worry too much about the cost involved. And also strengthening international collaboration. So as of now, we do not really have the advanced um, facilities for some of the reconstructive surgeries that are being done in the advanced world. So when we do international collaboration, sometimes our doctors are able to go and do their fellowships outside, and then they go and pick up some of the new or innovative ideas and services that are being offered. Then we can also develop plastic surgery in Africa. Then we also have to emphasize the use of telemedicine and then mobile surgical units. Telemedicine is, well, in the advanced world, there isn't telemedicine. It's not really a thing here in Africa, but with time, we'll be able to, because if we have telemedicine, then it even helps with the issue of rural areas that do not have access to places of surgeons we have, because then we can use telemedicine to interact with the patients, and then when they need to come to the hospital, then we can do that. So it helps with patient care. The mobile surgical units, we may not have a surgical center in the rural areas, but we have a mobile surgical unit that moves from place to place. And we can also, for now, be addressing the needs of people who do not have access to the plastic surgery facilities in the urban areas. So why does plastic surgery? Because it restores function after injury or disease and improves the quality of life and psychological well-being. And so restores function after injury or disease. From some of the examples I've given, we can see that after the surgery is done, patients who first could not show facial expressions is able to do that. Patient is able to blink now, and that's even taking away some risk that came with the initial predicament. Also improves the quality of life. Unfortunately, stigma is something that is with us as human beings. So if we restore the in- yeah, we restore to some extent the appearance, we restore function, and that can improve able to go out into society or do work. But because of plastic surgery, we are able to improve the quality of life of that patient. Also, psychological well-being. Yes. Also, it addresses then children do not have to grow up with anomalies that could have easily been corrected or even acquired defects. sometimes so that patients can live some kind of normal life. So in plastic surgery, it's a very diverse area because um, they think that plastic surgery can patients quality of life. Yeah, so it's not restricted to any one group or anatomical sites. Plastic surgeons treat children, they treat adults, they treat the elderly, they treat the young. Also, there's a wide range of subspecialties to choose from. So, from some of the examples you've given, we know that for plastic surgery, we are able to. There are a lot of subspecialties. You can do hand surgeries, you can do microsurgeries, you can focus on only burns and then burns reconstruction. You can also go into the aesthetic part of plastic surgery. So there's a wide range of subspecialties to choose from. Unfortunately, the problem is that plastic surgery is also a very competitive field, and yes, and in our part of the world where we do not have a lot of funding, and then some of the equipment and then the skills that the advanced world has, then it means that not a lot is done. And the last time I remember I joined this webinar, and then they were talking about the fact that because of the few numbers of plastic surgeons we have, unfortunately, people are not able to go out and and do the subspecialties in the areas they want to go into. But I think with time, if we can increase the number of plastic surgeons that we have, then we can appreciate the wide range of subspecialties that we actually have. So preparing for a career in plastic surgery. So first and foremost, it's important to understand what it is and whether that is what you want to do. So like I said at the beginning, a lot of people think plastic surgery is just about the aesthetic part, but then it's also more than that. There are so many other parts of plastic surgery, so you have to understand whether this is what you want to do. And so I learned about wasn't there even for the various parts of the plastic surgeries. There are lots of people that do not like the burns and reconstructive parts, but there are some people that also love it. But then you also have to do that first and foremost before you can decide to later maybe go into aesthetics. So you have to decide whether this is what you want to do. Then you also have to have mentors, because if you see one part of plastic surgery and you think because of that you want to go into plastic surgery, uh, that may not be enough reason, because there are other different parts. So as much as possible, you have to have mentors that you talk to who can advise you on whether on the realities of plastic surgery, so that it's not just what the little that you have seen. Also, it's important to do rotation in plastic surgery, exposes you to a lot more of the work, because I found out about microsurgeries. They said microsurgeries can take as long as 24 hours, and so it is not a very even though sometimes plastic surgery is more relaxed, going to something like microsurgery may not be as relaxed as you think, because of the intricacies of the work that they do. Sometimes it is actually very time consuming. Yes, then also research. You have to do a lot of research into plastic surgery, which helps you to understand what it's about and what is being done. Also, when you do research, it helps to appreciate the gaps that exist, because if you are doing research, then you realize that this is what the gap is, and then you begin to find innovative ways of addressing those issues. And then you also need a good academic foundation to pursue plastic surgery, because it is very very competitive. I did not find much information when it comes to Africa, but then for the world at large, the Western world, the US, for example, it's a very competitive field, even more sometimes even more competitive than neurosurgery. So you need very high grades, and it's not just about high grades. You need very good recommendations. So it's a very competitive field, and but then the fundamentals is that you should have a very good academic foundation. Then it requires precision, attention to details. Because it is about, I mean, at the end of the day, even for the reconstruction, you want to make sure that at the end of the day, it looks nice, beautiful. So there's precision attention to details. Are you very particular about your suturing? Are you interested in making sure that you leave minimal scars when you do your surgeries? That is very important. Then you need a strong knowledge of anatomy. You need to know your blood vessels. You need to know your nerves. Yes, so you need that for plastic surgery. Then also there should be creativity and aesthetic judgments. Even though we have pictures or we have proof of very beautiful procedures that are done for patients, we also have seen of very bad outcomes of some surgeries that are done. We have seen about celebrities that went in to get some form of enhancement and came out looking worse than they went in. So yeah, you need some creativity and aesthetic judgment so that you can be able to achieve um, a good you can give off good service. Then also emotional intelligence. This came in because of issues of patients vulnerability because sometimes what is making these patients want to come for service from you may not be reasonable to you, but I mean at the end of the day it's how the person feels about themselves. So that's where emotional intelligence also comes in. So training pathways. So, like we said, first and foremost, you have to be a doctor. So that means that you have to do medical school. So if you do medical school in Africa, and where it is mostly 6 years, and that means you have to do medical school 6 years. If you also do it in other parts of the world, you have to first do a first degree before you go on to do the medical school. So that is about 8 years, minimum 8 years. Then you have to do housemanship of 2 years, which is mandatory because that is when you become you are fully licensed to practice on your own. So you cannot skip that part. Then in Ghana, in some parts of Africa, you also have to have worked as a medical officer for at least 1 year in a district hospital before you can enter residency. But then now, Ghana, for instance, has introduced this new thing where if you were part of the top 10% in your class, then you can go straight to do your residency at the housemanship. So, I mean, this is information you can use at um, your disposal. Then, for now, initially, plastic surgery was always considered a subspecialty. So that meant that you had to do surgery first before you go to do plastic surgery as a subspecialty. But now we are seeing that they are introducing new what they are calling the integrated pathway, where you can just go straight into do surgery as a residency without the doing the general surgery first. Yeah, so but it is very competitive, and so if you are not sure you want to do plastic surgery, you could do the general surgery. So there are two pathways at the end of the day. There's the straight or the intermediate one where you go straight in to do the plastic surgery, and even that you are still going to do some form of general surgery, but this is an integrated and shorter pathway. Then there's um, the general surgery pathway where you have to first do a residency in general surgery. After that, then you go on to do a specialized plastic surgery training. Then there's fellowship. If you want to do advanced training, there's fellowship. So it is fellowship where you are able to go into pick one area. Maybe you want to just focus on hand surgery. You want to do just craniofacial. You want to focus on just burn and reconstruction or even aesthetics. So you are able to focus on one area when you do your fellowship. But when you do plastic surgery, you are exposed to all the areas of plastic surgery. So it requires many years of training. So career opportunities in plastic surgery, you can do clinical practice where you can do both and you can work with the public sector or you can go into the private sector. And like I said earlier, most of the cash is in the private sector. So, but that's also where you have a lot of the aesthetic surgeries at. But if you can also work in the well, you can work in the public sector and still have something private going on. But then yes, if you want to do clinical practice, that is basically it. Then there's also academia. Yes, you can also do research and then innovation. Now, What they think the future of plastic surgery? They are thinking that in the future we'll have 3D printing of implants for surgeries. Yeah, and then they are thinking that we'll have more advanced microsurgery. So innovation, people are thinking of, there are going to be more fine-tuned robotic assisted surgeries that will be ongoing. So you can go into research and innovation to find better ways to do surgery so that the outcome is improved. Then also humanitarian and then mission work. So there are quite a number of those. Currently, we know of Dr. Michael K. Obeng. He's a Ghanaian born American who is a plastic surgeon, and he is uh, the founder of Restore Worldwide, and they do surgeries. They come down to do surgeries in Africa, different parts of Africa. They come down and they do plastic surgeries for the less needy. We also have Smile. Smile is assisted with the plastic surgeon that actually they are assisted with the plastic surgeon, and then the team that did the establishment of the first burn center in West Africa. Yes, and they still do some humanitarian work for um, underprivileged people. So the future of plastic surgery, we are going to see. So the hope is that we'll see more of 3D printing. Yes, and then there will be tissue engineering, regenerative medicine, advanced microsurgery, and then AI and surgical planning. All of this with the aim of improving the surgical outcome, yes, of plastic surgery. So, in conclusion, plastic surgery is about function, form, and quality of life. Plastic surgeons are highly trained reconstructive specialists, and their field blends medicine, art, and ethics. It's not just about appearance; it restores lives, improves the lives of people. So, yes, these are some references. Thank you.
Wow, thank you so much. It was such an interesting presentation. Thank you. Let's thank Dr. Nyauyoe Dede. Okay, so the floor is open now. Um, any questions so far? Any questions, any contributions to the presentation? What a lovely presentation. I learned so much, but I'll keep mine to myself first. So I'd just like to hear from some few people talk about what they learned or any questions they have to ask so far. The floor is open.
I think someone raised their hand.
Hi, please. Somebody's hand is up. I think you can go ahead with your question. Hi, sorry, I lost connection briefly, so I did not hear you. If you could please come again. Yes, there is always the need to come to the hospital for something when it comes to medicine. But Consultations are done, and I think consultations can be done using telemedicine. And then from that point, if there's the need to move to the hospital, then that can be scheduled and then done. But initially, if we have telemedicine, then we have people who can communicate. They have patients being able to communicate with the plastic surgeons, and we do not have to worry about the location or the lack of facilities in their areas. But then for primary consultation, we can do that over telemedicine. If there's a need to move to the hospital, then we can move to the hospital. But yes, that's what I think. This is that fine.
Thank you. Any other questions? I have a question, so let me ask while people are waiting to ask theirs. So you said, doctor, you said that there are two pathways for plastic surgery. The first one is the integrated pathway that is shorter, and the other one that is the first you do general surgery, then you do plastic specialization. So how many years for each of the pathways? Like, how many years does it take to complete either of them?
All right, thank you. From the information I gathered for the integrated pathway, you are able to is about 6 years. That's the minimum, 6 years. So it's about 6 years for the integrated pathway. So you do a bit of general surgery, then you focus on the plastic surgery. But when you have to do the alternate one, which is when you have to do your general surgery. Then you have to finish doing the general surgery residency, which is about 4 or 5 years, and then you go and do the plastic surgery residency, which could be 3 to 4 years too. So in total, that's taking you to about 8 or 9 years of um, training if you have to go that route. Yes, thank you.
Thank you so much. Any other question? You can, if you don't want to turn on your mic, you can put the question in the chat box, then I read it out. And also I have another question. What advice would you give to students that want to specialize in plastic surgery? Since you're already finished medical school, like what advice would you give to us regarding like maybe volunteering, research, mentorship? Like what advice would you give in general?
Okay. I think for a start, I think everybody should find a way to be involved in research even before you finish school. Unfortunately, we are not, and in school they don't really put so much emphasis on that. But it is very important that you start. You may not be the first author, but then you have to, if there's research team, find a way, find a mentor, and then be able to join a research team, because it's actually very important. That is where you realize some of the problems that are going on, and that is where you may develop the interest to be able to solve some of those problems. So it's important that you you do research. Start as early as you can. Then also, I don't know for other schools, but I think during in school we are not exposed to a lot of plastic surgery. Um, for instance, I think the only plastic surgery I saw in school was burns. That's the only plastic surgery we saw in school, and then maybe the congenital anomalies that were treated, such as the cleft lip and palate. But other than that, we are not really exposed to. I mean, I was talking to a friend who said they were told once that there was going to be a breast reconstruction done, but we never saw any of those. So as much as possible, when you get the opportunity, engage with teams or people do who are doing other advanced surgeries and not just the burns and reconstruction we know, so that you'll be able to expose to you'll be more exposed to the other parts of plastic surgery. So, because like it's actually very fascinating the kind of things that plastic surgery is able to accomplish. So, find a way to if it is volunteering for a team when they come around to do a surgery, just find a way. And also mentors is very important. I don't know much for Africa, But in the advanced world, having a mentor is very important because all the people that have watched videos on who have been able to get into the plastic surgery residency program, they always emphasize the importance of mentors because it's a highly competitive field. But then if you have mentors who you talk to and who advise you on what to do and they see your dedication, it helps when people know that you are dedicated to the cause because then they can vouch for you. So as much as possible, have mentors. So yes, I think that is what, if I could go back, I'll do better. Yes, thank you.
Thank you so much. Can someone, I'm going to call names randomly to share something that you've learned from the presentation. So everybody be ready. Okay, Emmanuel Shikuta, please could you just share a short something that you learned from the presentation?
Hello, good evening, everyone. My apologies. I might not be in the position of using the mic as I'm using right now. I'm in the shop, so I'll just type um, what I've taken so far, my takeaway points. I don't know if it's okay.
Yeah, sure, that's fine.
Thank you.
Okay, while he's writing in the chat box, let me look. Um, Fireflies, note taker. Could you share a short something that you've learned from the presentation? Okay, seems he's not there. Okay, last person. Praises. Can you share something you've learned?
Hello, everyone. Thank you, Doctor, for the great presentation. I learned about the fact that we can, even though the subspecialty is competitive, with hard work and dedication, if we are really open to it, we can get there. And also that it entails way more than we usually think, because we think of plastic surgery and we only think of the aesthetic part, but there's, like, you expanded more on the reconstructive and the restoration of function part, and that was really insightful. Thank you.
Thank you so much, Praises. I'm just seeing your question in the chat box. She's asking the fact that you said the specialty is competitive. Is it also the same way in Africa and also on the subspecialties under plastic surgery? When you go for fellowship, can you do it only for one specialty?
Okay, thank you for the question. So yes, it is competitive in Africa because, well, we already have very limited slots, and so that means that only few people can get into it. So it is a very competitive field even in Africa, but we are hoping that with time there will be expansion, and then there will be the need to train more people in the field. Also, yes, when you do a fellowship you go in to one subspecialty. So when you do your fellowship you can just decide to do, you just focus on aesthetics, or you can just decide to focus on maybe hand surgeries or craniofacial. So yes, you're able to do that when you do a fellowship. Thank you.
Sorry, expanding on the question, what I meant is, let's say this time you do a fellowship on microsurgery. Can you later do a fellowship on another subspecialty, or is just that one that matters?
Yes, you can do another fellowship in another area. So there are people in reconstruction, they also specialize in aesthetic surgery, they are specialized in microsurgery. So you are able to do other fellowship. It doesn't have to be like just one. Thank you.
Thank you so much.
Thank you so much, Doctor. Thank you so much, everybody. Are there any other questions or contributions? If there are none, thank you so much, Ms. Dede, for that insightful and engaging presentation. We truly appreciate your sharing a journey and helping us to demystify plastic surgery and add to our knowledge. At this juncture, we would like to close the meeting. Thank you once again to everybody that joined, that stayed, that contributed one way or the other. And also, please stay connected with AfroPRS for future events. Have a wonderful day and evening. Thank you so much.
Thank you so much. Thank you very much. Have a good evening.
Okay, someone just shared something, but he said, thank you so much for the opportunity. I have learned that this field is more than just about plastic surgery. It involves other aspects of it, which I am interested to know more. Otherwise, I'm still enjoying the meeting. Thank you so much, Emmanuel. And thank you, everybody. Have a good evening.
You too. Thank you.